You mentioned randomized clinical trials. There are a couple of other clinical trials as well. Would you define them and tell us how they're different from one another?
Yeah. So a randomized trial is when you enroll onto the study and you get randomly assigned to either the experimental arm or the control arm. So the experimental arm is that new drug that we talked about, and the control arm is typically the standard of care. So that's a randomized study. And randomized studies are usually phase 3 trials, but they can be phase 2 in some scenarios as well. You have, usually that's paired with like a randomized control study. So a controlled study is just there's a control arm, that's what that means. But those are usually go hand in hand. Those are usually together. And then another trial is the double-blind clinical trial. So a double-blind clinical trial means that once you're randomized to either the experimental or the control, neither you or the physician know what drug you're taking. And that usually is not used in CLL trials. Usually we know what drug the patient is assigned to. And the reason why that is because oftentimes we're looking out for specific adverse events or toxicities from the drugs that we're implementing at phase 3. And then also if you're getting a triplet versus a doublet, meaning 3 drugs versus 2 drugs, it's very hard to blind somebody to know which drug they're on, because obviously you're getting 3 drugs versus 2 drugs. Or if an infusion is involved in one arm but not in the other arm, you obviously know if you're getting an infusion versus an oral drug.
Okay. Are there common clinical trial terms that you think patients should know about?
I think we covered most of them. So knowing that phase 1 is typically the first in the sequence of events, that I would ask your physician if this was a first in human study, right? Because that comes with some special considerations. Knowing that you are the first human to receive a new drug is very important. Versus a phase 3 study where, you know this drug has already gone through phase 1 and 2 of development, meaning it's given to a lot of patients and they're just looking to see if it's better than standard of care. So I think knowing those general concepts about what the difference between a phase 1 and a phase 3 study, it's very different. And so I think it's important to keep those in mind when talking about clinical trials and discussing with your doctor.